All we have this week is great news when it comes to medicine. And this one right here is the perfect way to kick off the week. This story's been around for a minute, but I already had a backlog, so I didn't want to, just step over anything else. But this right here is actually good news, and we'll see how long it takes for any of the appropriate bodies out there to really pick up on this stuff. Cancer trial using monoclonal antibodies finds remission in every patient. Let me run that back in case you missed anything. Cancer trial using monoclonal antibodies finds remission in every patient. Have we found a breakthrough when it comes to treating cancer? It looks like it. This is awesome. A cancer trial has reportedly become the first in the world to completely remove the disease in every patient. As somebody who has had two grandparents pass away from different forms of cancer at different stages in my life, I can't tell you how happy this makes me, okay? And the fact that, if we can finally put this horrific stuff in the rearview mirror, I can't tell you. This is so wonderful. Absolutely fantastic. According to a study published on June 5th in the New England Journal of Medicine. The study, PD-1 blockade in mismatch repair deficiency, locally advanced rectal cancer, was conducted among 12 rectal cancer patients, all of whom had a clinically complete response, according to the authors, led by Dr. Andrea Sarek of the Memorial Sloan Kettering Cancer Center in New York. Doctors have been unable to see any evidence of tumors among the patients when using magnetic resonance imaging, an MRI, fluorodeoxyglucose F18 injections, physical examinations, or endoscopic evaluations, according to researchers. So it seems by every perceivable metric, outside of maybe a blood test, looks like their cancer is gone, And this is specifically rectal cancer, but they were only just researching 12 patients with rectal cancer, So if we extrapolate that out, maybe, The patients also continued to show no signs of cancer during follow-ups ranging from 6 months to 25 months. That is so great. I'm being real hard trying not swearing here, and haven't had to undergo surgery or receive radiation and chemotherapy. That's just great. No adverse events of grade 3 or higher have been reported, the study authors noted. Specifically, the rectal cancer patients were given dostarlimab, a monoclonal antibody, every 3 weeks for 6 months. Patients had mismatch repair deficient stage 2 or 3 rectal adrenocarcinoma. Carcinomas? Okay, again, all of these fancy medical lingo ain't quite match with me. Type of cancer. Yes, thank you. We could figure that out with the carcinomas. The median age of the patients enrolled was 54, and 62% of them were women. 7 of the 12? Okay, cool. Could have just said that. Typically, such cancer patients would have needed to undergo often debilitating treatments such as chemotherapy, radiation, or surgery. Yeah, which would lead to somebody with a bag on their hip for the rest of their life, if you know what I mean. In extreme cases, be fitted with, there it is, said bag on their hip. However, after taking dostarlimab, you need to go ahead and make that a little bit more digestible of a name, which is sold under the brand name Jemperli. There we go. That's better. I like that one better. That's easier to say. No cases of progression or recurrence were reported in the patients who underwent the study. Jemperli. There we go. Is already approved by the U.S. FDA for use treatment of adult patients with mismatch repair deficient recurrent or advanced solid tumors. Rectal cancer is often an off-label use according to Medscape. According to drugs.com, the cost of Jemperli intravenous solutions is around $11,200. That's a lot for a supply of 10 millimeters. That's a lot. But at the same time, I don't know what the cost of chemotherapy and surgery and the rest of that stuff is. So every 3 weeks for 6 months, what's the price of your health? I'm just saying. The results of the study were also presented at the American Society of Clinical Oncology 2022 annual meeting. Mismatch repair deficient, locally advanced rectal cancer was highly sensitive to single-agent PD-1 blockade, the authors wrote. I'm sure that means something to somebody, but that sounds like good news to me. Acknowledging that the extended follow-up is needed to assess the duration of response. Yeah, they've only got 25 months, but it's better than nothing. It's incredibly good. Luis A. Diaz, Dr. Luis A. Diaz, Jr. of Memorial Sloan Kettering Cancer Center, author of the study, told New York Times that he believes that this is the first time it has happened in the history of cancer. As far as I know, the implications for quality of life are substantial. Yeah, you're getting rid of a death sentence. This is tremendous, especially among patients in whom standard treatment affect childbearing potential. Well, they're 54. I think those years are long in their rearview mirror as well. Given that the incident of rectal cancer is rising among young adults of childbearing age. Okay, yeah, no, exactly. I get it. The incident of rectal cancer rising among, childbearing age. The use of PD-1 blockade to eliminate the need for chemoradiotherapy and surgery may confer a particular benefit in that age group, the authors wrote. That is all. The rest of that is just just little footnotes to it. But honestly, like if I'm not coming across as being like excited enough for this, I'm sorry, but you know what? Hey, this is just overall tremendous news, and the fact that they're even just starting to make some inroads, because it seems like with cancer research, they've really just kind of hit a stalemate. Most of it's just been, we're just going to continue to use the stuff that kind of has like a hit and miss success rate. And okay, like just hopefully you can fix it via the conventional means of chemotherapy, surgery if they have the opportunity to, if it's not too, metastasized elsewhere. Other than that, it's like, here's a leather belt to bite down on so you don't, come to too much pain at the end of your life. But man, this can be used for, other treatments as well. Oh God, there's an opportunity to have something incredible happen here. So with all of that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.